So we talked about the normal development of the nervous system, and now we're going to talk about developmental disorders. So this is important. The central nervous system is most susceptible to major malformations between day 14 and week 20. Growth and remodeling continue, but later insults can cause functional disturbances or minor malformations. So that's something that you should know. Major malformations of the nervous system occur before week 20, and minor malformations occur after week 20. So there are different categories of developmental defects. Neural tube defects is one of the categories. Anencephaly is the formation of a rudimentary brainstem without cerebral or cerebellar hemispheres. So anencephaly sort of means no brain. It occurs when the cranial end of the tube remains open and the forebrain does not develop. The skull doesn't form over the incomplete brain, leaving the malformed brainstem and meninges exposed. This is not a situation that you can usually live with or recover from. Okay, the next pathology that's classified as a neural tube defect is an Arnold malformation. It's a developmental deformity in the hindbrain. There are two different types. Type 1 is often asymptomatic. Type 2 causes progressive hydrocephalus and paralysis of the sternocleidomastoid muscles, deafness, bilateral weakness of lateral eye movements, and facial weakness. So basically, the brainstem and potentially parts of the cerebellum that are normally inside the skull actually protrude below the foramen magnum, and it can cause, a lot of times, the symptoms that start to develop. Sometimes with type 1, you'll start to get cranial nerve type symptoms. So trigeminal nerve pain in the face, and facial weakness and weakness in eye movements. They can do surgery to correct an Arnold malformation, and so that is something that you can definitely recover from. The next neural tube defect is spina bifida, which is a defect that results when the inferior neuropore does not close. So there are three different types. There's the, and basically in level of severity, meningocele, myelomeningocele, and myeloscasis. So, I didn't list those on here. So a meningocele is basically, a lot of times can be very little effect. The myelomeningocele affects the muscle layer, and myeloscasis, there's actually an opening in the spinal cord. So one of the assignments for this week is having to do with spina bifida and researching some of the effects on that. The tethered spinal cord, the cord adheres to a lower vertebra, causing dermatomal and myotomal deficits in the lower limbs, pain in the saddle region in lower limbs, and bowel and bladder dysfunction. It depends on where the cord is tethered. If the traction is mild, the signs might only occur when mechanical stress increases, and a lot of times the onset of signs may not occur until adolescence or later as the person grows enough to put tension on the spinal cord. Spinal muscular atrophy, it's an autosomal recessive genetic disorder. Motor neurons with cell bodies in the spinal cord that innervate skeletal muscles degenerate, and it's the most common genetic defect is the deletion of the survival motor neuron 1 gene. That's the name of the gene. So type 2 is intermediate in severity, and type 3 is less severe. So with spinal muscular atrophy, it's the skeletal muscles degenerating is the main effect. So sometimes you get abnormal location of cells where the cell migration during the formation of the nervous system can go awry, and the results of it depend on the location of the cells. So sometimes you'll get abnormal gyri in the cerebral cortex due to an abnormal number of cells in the cortex, and heterotopia, which is abnormal location of cells. Seizures are often associated with this particular defect. Abnormalities of dendritic spines are found in many cases to cause intellectual disability. Dendritic spines are projections from dendrites that are common in cerebral and cerebellar cortex projection neurons. So a lot of times when you have a developmental disorder, there is a physical cause of it. So cerebral palsy is a movement and postural disorder that is caused by permanent, non-progressive damage of the developing brain. So that's a good definition to know. It's non-progressive. It doesn't change after the damage is caused, and it's permanent. The effects can include cognitive, somatosensory, visual, auditory, and speech deficits. And growing into a deficit is common with CP. So depending on what areas are affected, they might not show up until later in development. The nervous system damage in CP is not progressive, but new problems might occur when developmental milestones are typically reached, and that's the definition of going into deficit. So CP is classified according to the type of motor dysfunction. So there's these 5 different kinds. Spastic is damage to axons that are adjacent to the lateral ventricles. Dyskinetic, and so spasticity is usually an upper motor neuron issue. Dyskinetic, a neuronal damage to the basal ganglia, so it changes movement, and it actually usually makes it difficult to control unwanted movements. Ataxic is damage in the cerebellum. The cerebellum helps control coordination, so ataxia is usually uncoordinated movement. Hypotonic, it's unknown where the site of damage is with hypotonic cerebral palsy. And mixed is when more than one type of abnormal movement exists in one individual. So you should know the different types of CP and what the effects are. So it's traditionally believed to result from difficulties during the birth process. But actually, epidemiological studies are now indicating that 80% of cases result from events that occur before the onset of labor. So it might be genetic, it might be metabolic, immune, or a coagulation disorder, maternal infections, or endocrine and metabolic disorders. So hypoxia during birth is rarely a cause of CP, even though it has always thought to have been the cause. 80% of cases result from things that happen before birth. So there's a developmental disorder that's called developmental coordination disorder. Children have normal intellect without traumatic brain injury or CP or other neurological problems who lack the motor coordination to perform tasks that most children their age are able to perform. And the condition usually continues into adulthood. So attention deficit hyperactivity disorder, it's characterized by developmentally inappropriate inattention, impulsivity, and motor restlessness. I think that's an interesting statistic that between 9% of school-age children, around 9% of school-age children are affected by ADHD. So in ADHD, the volume of the prefrontal cortex, the caudate, and the putamen, which are part of the basal ganglia circuit, and the dorsal cingulate cortex and the cerebellum is reduced. So stimulant drugs increase the availability of dopamine and norepinephrine in synapses and improve function in some individuals. So it's interesting that the prefrontal cortex, that is an area where motor decisions are made, and other decisions. The caudate and the putamen are part of the basal ganglia, where dopamine and norepinephrine are created, and the dorsal cingulate cortex and the cerebellum. So it's actually a physical defect that causes ADHD. So autism spectrum disorders, there are 3 disorders along the autism spectrum that include autistic disorder, Asperger's disorder, and pervasive developmental disorder, not otherwise specified. That's the miscellaneous one, I guess. So people with autistic disorders engage in repetitive behaviors, have limited interests, appear to lack imagination, and are not really interested in interacting with others. Individuals with Asperger's speak and have normal or higher intelligence. They have limited social skills, they have a narrow range of interests, and they have repetitive and frequently obsessive behaviors that interfere with schoolwork or social life. Individuals with pervasive developmental disorder, not otherwise specified, they have atypical behaviors similar to autism or Asperger's, but do not meet all of the criteria for a diagnosis of autism or Asperger's disorder. So, infants who develop signs of autism later show traits at 12 months of age that include poor eye contact and decreased shared attention, communication, and social interaction. There are brain differences in autism, reduced communication among cerebral areas, and larger than normal amygdala during childhood. There's also abnormality in the shape of the caudate and putamen, which correlates with motor, social, and communication impairment. So again, physical defects in the brain. There's no relationship between the MMR vaccine and autism, even though that was a lot of anti-vaccine people touted that as the cause of autism. It is not. There was actually a physician who reported the association between the MMR vaccine and autism, and he had his medical license revoked for misconduct specific to the original study. So the journal that published the study also fully retracted the article. So unfortunately, it's caused a lot of people not to vaccinate their kids, and so now we're having outbreaks of diseases that were previously controlled by vaccines. So it's sad, really, but there you go. So just to sum up the developmental disorders area, major deformities of the nervous system occur before week 20. If it's a major deformity that has such a profound effect that causes a spontaneous miscarriage, a lot of times that happens before week 20. During the pre-embryonic stage, 3 layers of cells are formed, and the somites appear during the embryonic stage. So malformations of the central nervous system include Anencephaly, Arnold malformation, spina bifida, and forebrain malformations. So the important thing to know is understand the concepts of growth into deficit and when the major deformities occur before week 20. Minor deformities occur after week 20.